Hello, good evening. Welcome back to I Care for Your Brain with Dr. Sullivan, board certified neuropsychologist. That's me. We have had so much interest in this talk tonight. It is really pretty amazing, and it just shows you how common and normal avoidance symptoms are because people have been through a lot in life, generally speaking, and then, boy, this pandemic has really sent so many of us into a traumatic tailspin. The facts of the pandemic are one thing, but how they have really triggered people who already had issues with things like being trapped, having to do things they don't want to do, having things happen to them that they didn't want to happen. That is a lot of it for the psychological side of COVID. It's actually such a big topic that I have wanted to do a lecture about that for some time, but honestly, it overwhelms me a little bit. I haven't really been able to get my thoughts together, but I'm getting there. But this talk tonight really does fit in. So as many of you know, we are here. Try to be here weekly. That hasn't worked out very much in the last couple of months due to some other responsibilities I have. But tonight is going to be one of those long, in-depth, comprehensive lectures that I think you all really appreciate because it is empowering. It's empowering to understand what's happening to you and what to do about it. And in a very basic way, that's really why I'm here. This topic tonight was suggested by one of our Facebook listeners who said, you know, okay, I get avoidance, but what I want to know is how can I not give into it? And I thought that was such a poignant question because avoidance is so dang tempting. It's like psychological Velcro. It is really a form of self-protection that works in the moment. It really satisfies a very deep, normal human desire to avoid pain, avoid conflict, unpleasantness, negative feelings. And in the immediate reality, there is a relief. There is a feeling like, phew, didn't have to deal with that. But the problem is how it bites us in the butt in the future. So we're going to talk about some of those serious downsides to this negative coping skill with the hope that that motivates us to make changes. So the reason we talk about how bad these things are is it gives us the desire and the interest to make a behavior change. So when we don't challenge avoidance and we just give into it, the real psychological issue is that we never then get a chance to validate, live in the reality of what has happened to us. We don't get to process it. We don't get to grieve it. We don't get to accept it. We don't get to integrate it into our life story. And that is what the brain strongly dislikes. That is why things like post-traumatic stress disorder feel so bad to the person having them, is this feeling like this is not the right way to live. We're too separated from the trauma and ourselves. There's been no integration of that life experience with our life story. And that's part of what the brain desires, is coherence and a logical, linear narrative. And you can't really do that when you're avoiding, because the whole point is you're kind of shoving something away from your awareness or your reality. So if you have heard that saying, what you resists persists, that is a truism in human psychology. And that's really at the heart of what we're talking about. Meaning, in the short term, you kind of buy into the lie of avoidance, but what's really true is that it's just that, it's a lie. And in the end, it's actually making your anxiety worse. It's actually perpetuating the feelings of anxiety. It's not sustainable unless you are willing to live by its terms, which are having a very, very, very small world. And that is not how we are meant to experience life. We are meant to be brave and out there and experiencing things and connecting with people. So let's start with the definition of avoidance. Avoidance is rooted in a belief that you cannot handle how certain situations are going to make you feel. So you want to avoid it. You don't want to talk about it. You don't want to think about it. You don't want to be reminded of it. And mostly you don't want to feel it. There's this feeling that it would be too overwhelming. I might go crazy. I might actually die from the intensity of the reminder, the memory, the feeling. Avoidance beliefs lead to avoidance behaviors, and avoidance is actually a behavior. It's a choice in the moment of going towards the problem or moving away from the problem. It can involve doing something, right? Or it can involve not doing something. So doing something would be an avoidance behavior like trying to wash your hands 50 times a day, because if you believe you do that, you're going to avoid getting COVID. You're going to avoid getting the flu or germs. We do a whole lot of not doing avoidance, which is putting off a awkward conversation, not talking to someone assertively about a way that they've hurt our feelings. Avoidance behaviors are negative coping skills. And again, it's that false belief that they're going to really help you, but in the end, they wind up just being a huge backfire. Like so much of human behavior, avoidance exists on a spectrum. So on one hand, we can have just distracting ourselves. If a movie is on and there's a scene that makes us feel really uncomfortable, like someone's getting assaulted or attacked, we can kind of go off in our minds. We can look at our phone. That's very straightforward of a way of avoiding. But we can also really get into some phobic behaviors, like completely avoiding it, not going to the doctor ever again, never going back to the hospital, because that place is the trigger of anxiety that we're trying to avoid. Behaviors are different in avoidance depending on who you are and what you're trying to avoid. It's really personal. It's your life story that dictates what type of avoidance you're going to do, although there are a couple ways that humans do this. For some people, they are engaging in situational avoidance. So what this is as the name sounds, is that when you get in a certain situation, oftentimes it can be, a party, too many people, a bridge, a road where you had an accident, the hospital where you went after you had your stroke, a smell. Smells are very big in avoidance and trauma because it's the only sense that isn't buffered by the brain. It immediately goes into the brain. There's no kind of pre-programming. It's a direct route right into the emotional part of the brain. So smell triggers are huge for people, but it can also be not answering your calls, not looking at your phone for text, not opening your mail. Does it sound familiar to any of us? There's also cognitive avoidance. This is avoidance within our own selves to have certain thoughts, to have certain feelings, or have some memories that might be overwhelming to us. We consciously avoid things by saying, don't think about that, right? That's very straightforward, but we also do a lot of numbing behaviors, which are avoidance. So this is, alcohol, food, video games, even sometimes benign things like reading, crocheting, anything that really helps you zone out so you don't have to be present can be considered an avoidance behavior. But when you push something away hard enough and long enough, it doesn't just go away in that little box. If it did, I wouldn't be talking to you, because I'd be like, do it. It's cool. It helps you in the long run. But the truth is, cognitive avoidance always pops up, right? And it pops up with a vengeance. So the longer you push something down, the more likely you are to create a broken record in your brain that just keeps on playing and playing and playing. And you can get intrusive thoughts where an image will pop into your mind. You can avoid it all day long, but when it's time for bed, man, the thoughts, the fears, the anxiety just come back to you. Somatic avoidance is really big in our brain health community because so many people have had neurological injuries where they remember how they felt while they had a stroke, a traumatic brain injury, things like this. So these folks can avoid feeling. So any type of strong feeling. People start to avoid exercise. They start to avoid intimacy because they don't want to feel an increased heart rate. They don't want to sweat. Their sweaty palms are now all tangled up with these traumatic, hard to deal with memories. With somatic avoidance, you're just trying to avoid the internal sensations that you've now associated with extreme emotional distress, right? So what usually happens is that you don't get to just avoid the bad stuff, right? This is one of the worst things about avoidance. What you're really doing is putting a big, heavy, wet blanket on all emotions. And this is part of what's at stake, why you need to make a change. And I'm so glad you're here tonight with me, because you wind up having a very emotionless life where you feel very numb or very separate from people. One of the questionnaires we ask about as neuropsychologists related to emotional numbing is, do you feel like you live on an island? Do you feel like you're unreachable? Have people said that to you? Do you feel like you are untouchable, that nothing seems to rattle you because you're just really detached because all the emotions have been shut down? So who is likely to use avoidance behavior? Well, there's personality traits that come from our genes, our families. For people who are just very uncomfortable with strong feelings, right? And it can just be their judgment about a strong feeling. Someone labels a anxiety feeling like it's an out of control, helpless feeling. People don't like to feel that. But those of us who are most prone to avoidance have high anxiety at baseline, especially people who have experienced trauma. So if this talk really speaks to you, you may be someone who's living with post-traumatic stress disorder. If you've had a medical crisis, I know a lot of you lovely people listen to me because you're in the stroke community, you're in the TBI community, the dementia community. We often don't put medical issues in the domain of PTSD. We still think about it like military and rape victims. No. Anything that is life-threatening, that made you feel helpless, that made you feel horrified, terrified, that all qualifies, okay? Anyone in their life experience is capable of becoming totally anxiety-ridden and avoidant after a crisis. We use avoidance because it makes us feel like we are exerting a choice, like we have some type of power. Trauma makes us feel like we've lost our power. That's why it's so painful, is because a lot of us, we walk around with an illusion. If I do X, Y, and Z, life is going to give me A, B, and C. And when you have a trauma, your safety bubble gets burst, right? And you now realize that unexpected, unwarranted things happen to good people. That's just the way it is. So when we learn to avoid, it's so tempting to give into it, like I keep saying, because it just, in that moment, you don't realize what you're really giving up, and it can become a habit. You might have also never seen someone exhibit active coping. You might have just come from a family where people turn a blind eye. People have never shown you what it's like. So that's why we're here, is once we understand what's on the table, then we're going to talk about what to do about it. So the real issue is that anxiety is present, and it feels very overwhelming and very strong, and can really feel like it's going to take us down. The avoidance creates the vicious cycle that is really at the heart of feeling anxious in a long-term chronic kind of a way. So we're actually adding fuel to the anxiety fire by avoiding. And that is a hard thing to wrap your head around, because it doesn't feel like that in the moment. It really feels like you're doing yourself a favor. But when you avoid, think about it, you're not acknowledging that the thing you're avoiding has really hurt you, whether it's a person, a medical event. So you're not really accepting and holding and processing experiences of sadness, of difficulty, the really hard things that have happened to you. And so you really try to push them outside of your awareness. And like I said, brain does not want that. Your spirit does not want that. It gives us the message too that we can't cope with something. So we're really taking away our power when we avoid things, and we never get the life chance to try it and see that it doesn't kill us, it doesn't take us down, and that we are able to at least try to face the things that we are so fearful of. Avoidance also just doesn't affect you. It can really be frustrating for people in your life and create conflict, because in a way, you're yelling to people like, I'm on fire. There's not something is not going well here for me. I have a lot of anxiety, but on the outside, it can look like you're not doing the very things that might help you. So it can really push people away, and you wind up getting less social support than you really need, because you don't make an effort to do some of the things like go see other people, go and be social. So it's really helpful to let people who love you maybe watch this video to understand a little bit more why you don't want to do the things you don't want to do. So like I said before, with avoidance, if you don't address it, it will spiral out of control. That's oftentimes when people come to treatment, because they can't tolerate it anymore. Think about avoidance like putting a drop of ink onto a really high quality piece of white watercolor paper, right? It doesn't just sit there, it spreads and it starts to consume more and more of the paper. The other things make you more and more anxious. Other things fall into that line of a trigger. Triggers don't just stay the hospital. Then they become the smells that also kind of smell like the hospital. You may be cleaners, right? Then it becomes, even going to the nail salon to get your pedicure, because it also kind of reminds you of like a clinical medical thing, right? That's true. It really does engulf more and more of your life. So then you can start to avoid all sorts of things like your responsibilities, your family, your work, paying bills, your friends, your social life. That is really one of the hardest things, is you don't get to pick and choose what avoidance you are going to engage in every day. You're typically blocking out a lot more than you might be cognizant of. So now you're going to try to take my words and make them personal, because that is the best method I know to educate you all about brain health and psychological health. Is I share some kind of universal human ways of responding, and then you take my information and you make it personal to you. So here's what I would love in this next section of this lecture is, as you are comfortable, share with me on this page right now the answer to some of these questions I am going to ask you. What I really think we need to do before we get into the recommendations, what are the treatment interventions, is we really need to think about what avoidance has cost you, okay? How much time and mental energy have you put into avoidance that you've taken away from other important areas of your life? How has it affected your relationships? How has it affected your confidence, your feeling of being a capable person, because you're no longer doing the things that give yourself the message that I am able, I am competent, I am capable, okay? So there is a website called thehappiness.trap.com, and they have something called the Costs of Avoidance Worksheet. And I am going to walk you through that worksheet right now, but I want to acknowledge this isn't mine. This is something another psychologist came up with. And what they encourage people to do is to complete the following sentences, okay? This is how you'll know what to target in the next phase of the lecture, which is how are you going to get out of this? How are you going to do better? So answer these questions. The thoughts that I would most like to get rid of are ... The feelings I would like to most get rid of are ... The sensations in my body I would like to most get rid of, and the memories I would like to most get rid of. Now, share at your leisure, but that's the target, okay? What you are avoiding, what you wish you could change, what you wish was different. That's where you're going to see your avoidance map. That's going to be the way you're going to take my next evidence-based recommendations to heart and make them personal. And it turns out this is key, okay? You really need to understand what you're losing with continued avoidance to have the motivation and really the bravery to make different choices, because avoidance is a coping skill. So you're actually acting on a belief you're choosing to avoid in that moment. So you're going to start to imagine what life would look like without all this avoiding. What would you be doing different if you weren't afraid of doing certain things? Maybe that's a little bit more comfortable to share publicly. So once you go through those exercises, if you're watching this on replay, pause me and then come back. You realize you're avoiding. We've talked about what's at stake. You're really ready to change. Now what? Karen, what am I going to do? Okay, guess what? I'm here to tell you. I've done the research. The first thing is you're going to shift your perspective. You're going to, instead of thinking of the relief you get in the short term, you're going to start to think about the long term, what you've lost, how this has taken you away from your values. What is most important to you in life? Who is most important to you in life? The way we show up for our values is by our everyday actions, right? How are we showing that we prize that person? How are we participating in life with them? What is our daily commitment to show up for our values? So once you see how avoidance has interfered with that, you're going to realize how much you've lost. So now you're going to start to think long term, not just the relief in the moment when you say, no, I'm busy tonight, I'm not going to go. You're going to think long term. Am I showing that I don't value this person in a relationship, right? I need to find a way to break through my anxiety and make a commitment. You're going to start to actually recognize that you're avoiding. You're going to shift out of autopilot and you're going to start to get curious about why it is that you don't feel comfortable. And this idea starts with radical self-truth, one of the best concepts ever, which is just get real with yourself. Get honest about what your barrier is. So for some people, it's a lot of interpersonal avoidance. For other people, it's a physical space. It's the way you feel inside. And what you're going to do once you've got all that sorted, your motivation, what you're doing, why you're doing it, you're going to build tolerance to the anxiety. You're not going to jump in. You're not going to one day turn the page and be a completely different person. It's not easy to go from being fully cocooned in the cozy, numb world of avoidance to all of a sudden being out there with these big new feelings. Okay, you're going to ease into exposing yourself to anxiety-provoking environments with compassion for yourself, not judgment, because why haven't I done it? What's wrong with me? I can't do it. You're going to stick your toe in the pond, believing that small steps are possible, that you are capable of doing it, and that you can do it in a way that is gentle and kind to yourself, okay? This type of exposure, this type of intervention is called exposure. So the more you avoid something, the more anxious it makes you. The more you do it, the less anxious it makes you, okay? High anxiety physiologically really cannot sustain itself for more than 10, 15, 20 minutes. It's very hard on the nervous system to stay at that intense level. What you will find, this is another truism of human psychology, is the more you can tolerate being in the environment, you will find that naturally, over time, your distress starts to go down. It's just the normal way that the nervous system is built. If we never get through that first 10, 15, 20 minutes, you're going to think that if you stayed, you would remain that anxious. And that's just not true. The bravery comes in tolerating the first steps, okay? Another piece of advice is not to do it alone. I would love for you to have a trusted person to support you and hold you accountable as you try to make these changes. I don't want the person pressuring you, embarrassing you, not understanding. We're looking for a trusted person that you can start to share some of these avoidance tendencies with. One of the ways you can do that is by, again, this radical self-care, self-honesty, is if someone says to you, hey, how you doing? To really be comfortable with trusted people, being honest about your anxiety. You know, I'm not great, honestly. I'm feeling really anxious about this upcoming neurology appointment. You know, ever since I had my stroke, I just get so anxious when I go to see the doctor, and I just feel like I don't even want to go, and I even canceled last time, right? And then the idea is your trusted, kind, nice person is able to reason you through it, maybe offer to go with you so you don't have to be there alone. You know, gives you idea of, okay, let's do this, and then we're going to go out to lunch. We're going to have a reward. Let's get together later. That is what a trusted person should be offering you inside your life. You're going to give yourself credit when you do make a step forward, okay? You're going to give yourself lots and lots of self-care. It's going to be stressful in the beginning, I'm not going to lie to you, but I think the pride and the confidence that you are going to get from these baby steps are really going to make you feel like you can handle bigger and bigger things. One of the key things you need to start to do is learn more control within your body of how to calm yourself down. So these are activities that activate the parasympathetic nervous system. These are the things that calm us. So slow breathing, right? We have control over that. We have control over deep breathing. That's going to slow down your heart rate, okay? You know, having a cold bottle of water with you is going to help you not sweat. So you have to think about ways that physiologically you can bring the body down. Think of these like tools in your toolbox, right? You're going to learn how in the moment through breathing, through maybe doing some journaling where you can be honest, meditating, stretching, you're going to build up a repertoire for when you feel anxiety, when you feel emotional distress, you're going to be able to calm yourself down in the moment. And the belief that you can do that will take away the core belief that has made you avoidant, which is I can't handle it. As soon as you know in your bones that you can handle it, that's more than half the battle. But you have to get there by proving to yourself that you can calm yourself down. So in addition to finding ways to feel calm and soothed within your mind, your body, you also need to do some exercises that will help you feel strong and competent and in charge of your life, that you are in the driver's seat. People do this through exercise. They do this through getting better at a hobby. They get at this through volunteering, doing acts of kindness. Think about in your mind, what do you believe a strong, capable, competent person does? And basically do that. Remind yourself of times that you've been able to do it in the past. Replay those moments in your mind that will help you not give in to those what ifs. What if this falls apart? What if it's a catastrophe? What if I embarrass myself? What if I die? You're going to really work on this new belief that you have competency. The other belief you're going to work on is that uncomfortable feelings like anxiety are not bad. They are not going to kill you, okay? And when you realize that they're really getting in the way of living your values, that's like an epiphany where I think that's where we decide, I'm going to have to change. So thinking about how you've grown to believe that anxiety is the worst thing or conflict is the worst thing, those are helpful to kind of understand your own background. But this whole practice of mindfulness is really helpful here. This is the idea of being able to just sit with something without changing it. So 2 cool things you can do at home to really feel this, experience this. The next time you have an itch, okay, instead of immediately going to scratch it, you're going to actually try to breathe through it and not scratch the itch. You can also take an ice cube in your hand and hold it over the sink or the trash, the bin, as it were, and tolerate how stressful that feels, knowing you can drop it at any time, but that you can also handle that level of distress. These are called distress tolerance skills, and they really, really do help. You want to see the thoughts, the feelings that arise, and then you want to show yourself that they always pass. They always, always pass. Nothing is going to be there forever. You're going to observe how the stress affects you, but also pay the closest attention to when you are coming down from the stress, okay? This is the foundation. Now you're ready to try different ways of coping. Okay, that was all the preamble, right? You've learned how you're not going to tense up, right? You're going to identify when triggering thoughts happen to you, why it is you feel like you want to give into avoidance. You're going to learn how to self-soothe. You've got a portable set of skills you're going to bring around with you. Now we're out of negative coping and we are in the land of active positive coping. And there's 3 main types, okay? There's active behavior coping. This is where you actually make a plan and put it into action. How am I going to change this situation? Within that type of coping, there's the world of what you can control and the world of what you cannot control. And right, life is the wisdom to know the difference, right? That's one of the best prayers. What is in your control is changeable. What is not is not. So sometimes mapping that out can be really helpful. Number 2 is active cognitive coping. This is changing how you think about a certain situation. The third one is when you really can't do anything and it's maybe even hard to change the way you think about it. This is active acceptance coping. So this is learning to believe and understand and accept that certain things are beyond your control, certain things have happened, and certain things are the way they are and need to be accepted and accommodated for. That's really one of the hardest ones. So learning not to give in to avoidance is a journey, okay? It's all about getting ready and then trying. So if you, with kindness, start to take baby steps in this direction, I think you will feel better because of the new positive coping, but also because you're trying, you're keeping a commitment to yourself. So what I would love to know at the end of our time together right now is, what are you gonna do? What will you do different? How are you going to keep the enthusiasm, the motivation that you have right now for wanting to make a change? Of course, if nothing I said feels like, God, it didn't really, hit the nail on the head for me, that's fine. You should then find another professional that you can work with in life to help you figure out what's going to work for you. Again, what I said tonight are the top of the evidence-based strategies. They might not necessarily be what works for you. If you guys thought that this was helpful and that other people, especially in the brain health community, need to hear this, please share this widely across Facebook. We are really here to simply spread good quality scientific education and to help people feel better. We have a very easy to search list of previous lectures on YouTube. If you're someone who's new to the I Care for Your Brain world, you can go there and see what I've done in the past. I have recently made a commitment to doing an update on essential tremor, one of my closest communities in the brain health world, and I'm going to get on that in the next few weeks. I'm always open for suggestions on what it is you would like to hear me lecture about, so please feel free to send me a message here on Facebook. Thank you so much. As always, I really appreciate the opportunity to be with you. Being here with you is me living one of my values, which is giving back and supporting the brain health community. So by you listening, you're actually really helping me. I hope that I've helped you in some small way. Thank you all so much, and I hope you have a great night and a wonderful tomorrow. Bye-bye.